I have depression when I was a med student. I was studying and I was doing all this stuff, and then slowly I started to see my personality whittling away into this nub of a person. Are there any other doctors here in the audience tonight? Any doctors besides my 3 friends that came? Okay, guys, if anything happens tonight, definitely rely on that. Okay, definitely. And it wasn't until I didn't know what was going on at the time. I mean, I was just a med student. I didn't know what was going on at the time. And it wasn't until I was on my psychiatry rotation that I actually diagnosed myself with depression. Yeah. And so in order to meet the criteria for depression, it comes in this very fancy book called the Diagnostic and Statistical Manual, or the DSM. Some of you guys may know what this is. It's not exactly beachside reading or anything like that. So I brought an excerpt of the DSM because I wanted to just, healthcare is expensive, so we can all troubleshoot this together. But in order to be formally diagnosed with depression, you need to meet 5 out of the 8 criteria for the DSM. So I'll go through the criteria. You can just clap if you meet any of these. You have to suffer this for the same 2-week period, okay? So, criteria. Number 1, depressed mood most of the day. Okay. Not bad. Number 2, diminished interest in all or most activities. Okay. You're so enthusiastic about your diminished interest. Number 3, fatigue. It's like fucking America. Okay. Number 4, feelings of worthlessness or excessive guilt nearly every day. Okay, all right. Number 5, inability to concentrate. Okay, well that's 5. That's pretty much it. All right. No, wait, here's number 6. Your name's Priyanka Wali and you're going through medical training. Hey, hi Priyanka, how are you? It's me, the DSM. Yes, you're depressed. Okay, yeah. So at that point I knew, okay, I was a med student, I knew I had depression, but I was too busy. I was working, I was seeing patients, doing the thing, trying to pass all the tests, and it wasn't until my psychiatry rotation that I met Dr. Earl, who is this sort of mad scientist, and he's like, Priyanka, this next patient has admitted himself to the psychiatry ward. You need to go interview him and give me your assessment. Hi, I'm Dr. Wali. Why don't you tell me what's going on with you? I don't see the point of life. Life has no meaning. I was like, yeah. Do you ever feel worthless? All the time for no reason? Yeah. Huh. Yeah, me too. Do you ever feel guilty, even though you've done nothing wrong? Yeah, of course. Why wouldn't I? And do you think life has no meaning? Yeah, of course. We're just specks in a larger system. I had never put such a fine point on it like that. That's great stuff. So, Priyanka, what is your assessment? He seems fine to me. Priyanka, this patient is clinically depressed. He needs to be admitted to the psychiatry ward and started on antidepressants immediately. Well, shit.